Sedation is a very commonly used, safe and effective procedure that we carry out quite routinely, and it is where we use a special medication or a family of medications to help calm and relax our patients. The calmness is instantly generated, and patients generally have no phobia or anxiety during the subsequent treatment, which we can carry out in a very harmonious and seamless manner. The type of sedation that we carry out at Zental is known as conscious sedation, and this means that the patients are still awake and able to communicate with us, but in a state of drowsiness and euphoria and relaxation, which allows us to carry out the treatment in a nice, serene environment. The main benefit of sedation is it instantly reduces anxiety and phobia in any individual, and it creates this sense of calmness, euphoria and relaxation, and a general sense of well-being. Fear, as we all know, is a very strong emotion that we often can't control. It can grip us in the midst of our day-to-day activities. Now imagine being in a situation where you're gripped by fear and you're able to instantly switch that off momentarily or for a prolonged period. How would that make you feel? This is the magic of what sedation can do. There are many other benefits, such as it helps to reduce the perception of time. So a 3 to 4 hour procedure, which otherwise would be very tiresome for any patient, can actually feel like only 5 or 10 minutes. So it also allows us to carry out a lot of treatment within a shorter period of time without patients getting tired and without them feeling overwhelmed with what they've undergone. So in terms of how the process of sedation works, for every patient that requires sedation, it's essential that we first do what's called a pre-assessment. And this is a visit where the patient will be invited to have a face-to-face consultation with the sedationist, where the sedationist will assess their suitability for sedation and will also assess their levels of anxiety, try and determine the needs of the patient and how the sedationist can assist the patient for their subsequent treatment. This consultation is invaluable as it allows a face-to-face communication with the very treating clinician that will assist the patient in their subsequent journey. Now, there are instances where sedation can be carried out on the same day as a pre-assessment, but usually we like to have this pre-assessment done first. Once the treatment has been planned, the subsequent visit will involve the sedationist administering the sedation on the day of the treatment, and that will create the instantaneous calmness and relaxation. The sedationist will be there throughout the whole procedure with the patient and will ensure that the patient is well looked after and always in a state of calmness throughout their dental care and treatment. So as a patient, the sedation that we carry out as Zental can benefit you in many ways. So if you have a particular dental or needle phobia, then sedation is for you. If you have a low pain threshold and would like to have a truly pain-free sedation experience, then sedation is definitely for you. There are a lot of patients who have a very sensitive gag reflex, where even the sight of a toothbrush or even using a toothbrush elicits a very reactive response where they start to retch. Thankfully, sedation is very effective at reducing such gag reflexes, and treatment can be carried out quite effortlessly with sedation. We all know that the mouth is the gateway to the body, and it's scientifically proven that oral health leads to a general sense of well-being and general health. And conversely, poor oral health can also affect our health detrimentally. Now, sedation is an invaluable tool which reduces the barrier for a lot of patients to facilitate them getting into a state of oral health, something that they may have put off for many years because of a bad experience in the past, because of a particular anxiety or phobia. Now, with the tool of sedation lowering that barrier of entry, it allows a lot more patients to benefit from obtaining an optimum level of oral health a lot quicker, and consequently that will lead to better diet, better nutrition, a better sense of well-being, a better sense of psychological and social well-being as well, and ultimately to a general state of health, happiness and well-being. So a specific example of how this procedure benefited a patient and their well-being. I had a patient who had not been to the dentist in over 30 years. She had a very severe anxiety and a genuine phobia of dentistry, and it mustered a lot of courage for her to even come to see me. And the only reason she was able to come to see me is because the state of her teeth had got to such a state of disrepair that circumvented her level of phobia. She needed something done and needed it done urgently. She was not able to eat. She wasn't able to smile. It was affecting her social confidence and her ability to interact with others. She could no longer hide the issues that were now affecting and impacting her life. When she came in, she was pleasantly surprised that we could actually help her, and we could actually help her in a way that would allow her to have quite extensive treatment in spite of not having treatment done in many, many years, and for it to be done in a way that wouldn't cause any further detriment to her existing anxiety. For such a patient, unfortunately, she did have to lose all of her teeth, but we were able to do what's called an all-on-4 procedure, or a teeth-in-a-day procedure, where we gave her dental implants at the same time as her teeth being removed. And this was all done under dental sedation, and she was given an instantaneous smile on the same day, to the extent that she, for the first time in a lot of years, started smiling and was immensely happy with what she had just done. And she actually told us that this was the best thing she had ever done in her life, and it's transformed the way she now interacts with others and improved her confidence immensely.